Hi, everybody. I am Dr. Britt Talley Daniel MD, and a neurologist, headache doctor. I have a migraine textbook, two of them on Amazon, and a migraine blog. That's at www.drmigraine.com. And I wish you'd click subscribe to my account here so we could follow each other. Today, I'm adding to a number of other migraine headache videos this current problem, which is, what is medication overuse headache? Well, if you practice headache in America or in the world, the number one thing that's going to come into your office is going to be patients having daily or near daily headaches from overtreating with something, and that's what's called medication overuse headache. So the International Classification of Headache, which is a organization that gives credit to headache medicine and treatment and documentation of diagnosis all over the world, have named medication overuse headache. And this used to be called, and commonly still is called, rebound headache. It's kind of like a basketball term. So you throw the basketball up, it goes back down, you throw it again. With medication overuse headache, the patient overtreats, headache goes away, headache comes back, so they take another pill. First, I want to talk about chronic daily headache. Chronic daily headache is defined as a person who has 15 headache days a month, 8 of which have migraine features. Migraine features are one-sided headache. As migraine comes a word that means half of head. Headaches that may be throbbing, tension type headache or pressure and tight in description, but they're not described usually as pulsing or throbbing. And maybe a severe headache. So on a scale of 1 to 10, tension type headaches can only go to 5 or mild or moderate, but migraine can go to 5 or 10, or many patients sit across from me and will say, I got a 20 level headache with a scale of 1 to 10, so it's a horrible headache. These may be headaches associated with nausea or vomiting and sensitivity to light and sound and smell. Those are the migraine features. All right, episodic headache is defined as less than 15 headache days a month. So many persons who present with chronic migraine then are overtreating and have medication overuse headache, which is 80 to 90% of all the patients a headache doctors can see in his office or in specialty clinics, and it affects about 4 million people a year. It comes from overtreating painkillers or headache medicines, which could be simple over-the-counter drugs like caffeine or Tylenol, Advil. In Europe, they call it Tylenol, paracetamol. It could be opioid narcotics like hydrocodone or tramadol, or it could be one of the barbiturate drugs like Fiorinol or Fioricet, which has Tylenol in it. And the problem with the medication overuse headache is these patients typically rotate drugs. Many of these folks will be taking, they'll be taking 400 or 500 or 600 milligrams of caffeine a day. I always do a caffeine add-up when I talk to patients. How many caffeine drugs do you take? How much coffee do you take daily? My heart sinks when they come in and sit down across from me and they're drinking a Starbucks Grande cup, which has got 550 milligrams of caffeine in it. Just regular coffee that you can, like Folgers is about 135 milligrams of caffeine. Dr. Pepper is 39 milligrams. The highest caffeine dose for any pop is like Mountain Dew. It's like 49 milligrams of caffeine. So anyway, they could be taking something like that, or they could be taking opioid narcotics, or the worst drugs you can take here are barbiturate drugs like Fiorinol, Fioricet, or even one of the triptans. And the problem is that these people are just over-treating with these drugs, and they take too many drugs which can aggravate the headaches. It's not uncommon for the headache doctor to see somebody taking, 400 to 600 milligrams of caffeine a day as coffee, and they even may use an Excedrin migraine, each tablet which has 65 milligrams of caffeine in it to treat mild headaches. And they may be taking over-the-counter drugs like Tylenol, Advil, and then they may take their triptans like sumatriptan or whatever the drug is the doctor is giving them for migraine 3 or 4 days a week, and you're only supposed to use those drugs 2 days a week. And then they have all these chemicals that give them a headache. So, what is medication overuse headache? The International Classification of Headache describes frequent headaches with the following classes of drugs. So if you look on the internet on this or read the book on it, it is listed as ergotamine, overuse headache. Now, ergotamine is an old drug. When the triptans came out about 1990 or so, most of us quit using ergotamine, but there's still drugs around and people will take them. There is triptan overuse headache. There's non-opiate analgesic headache. That's like Tylenol, Advil, and stuff like that. Tylenol, acetaminophen overuse headache. Aspirin, acetylsalicylic acid overuse headache. There could be other non-opiate analgesic overuse headache. There's opiate overuse headache. And then they have what's called combination analgesic overuse headache. So that's someone who's taken a painkiller like tramadol and then Tylenol and some caffeine. So the International Classification of Headache lists drugs that may cause medication overuse headache, and I'm going to just kind of go over those with you here a minute. That could be any of the triptans, and there's 7 triptans. They've all gone generic, or ergotamine intakes. If someone takes a triptan or ergotamine more than 10 days a month, like sumatriptan, that can give you medication overuse headache. If you use non-opiate simple analgesics more than 15 days a month, these are aspirin, Tylenol, caffeine, or Advil, that will give you headaches. If you use opiates or analgesics combined with barbiturates more than 10 days a month, that can give you a headache. Now, several years ago, the FDA limited the use of hydrocodone, which used to be like on a normal prescription. You could write it on a pad or you could call it in the drug office. But so many people have died from it, become addicted to it. We're still in the middle of the opioid crisis in America. It's been a horrible thing and it caused a lot of deaths and problems. So they've changed the dosing of hydrocodone. So you have to write it on a prescription level drug. That you have to buy those prescriptions from the drug, like the Federal Drug Agency. They cannot be refilled. You have to come in and get them from the doctor. You can't call them in. And so a lot of doctors switched over at that time to tramadol, which is a generic name of Ultram. All right, so patients who have presented to the doctor with chronic migraine may have all these problems. Now, there's a transformation that occurs from episodic migraine to chronic migraine. So many of these folks will say, you know, for years I've had, daily headaches for maybe 6 months or 3 months or a year, or maybe 10 years I've had daily headaches and really bad headaches 3 or 4 times a week. Well, that's clearly chronic migraine, and chronic migraine is usually medication overuse headache. And then patient usually may be able to relate, say, well, I used to have migraine not very often, like once a month. In the last 6 months now, I'll have them 3 or 4 times a week. And that's the development of the transformation from episodic into chronic migraine. So what are the clinical features of medication overuse headache? Well, there are 2 main clinical features here. One is they have frequent or daily headaches, which come with migraine features, which I've already gone over a little bit: sensitivity to light and sound, nausea, vomiting, irritability. And the other factor is not well known by doctors, and most patients don't know this, is it causes serotonin, a calming brain neurochemical level, to drop in the brain. So overtreatment with these chemicals, we don't know why, but the literature states that overtreatment with medication overuse headaches made serotonin levels go down. And so serotonin relates to, depression, anxiety, and treatment for things like that. If you're anxious and you take Prozac is a drug that raises serotonin. Those are called serotonin receptor inhibitors. They raise those drugs. So this syndrome of medication overuse headache can worsen anxiety, generalized anxiety disorder, panic disorder, insomnia, depression. They may cause poor concentration, panic attacks, which are core symptoms of the disease. And I tell patients, even if they're taking Lexapro or one of the SRI drugs for treating their anxiety, the drug's not working well because of this medication overuse headache problem. And if you detox patient, get them off the drugs, and give them a month or so to clear up, they'll feel a lot better without really changing their psychiatric medicine. Okay, the other thing is I need to talk about is the migraine timing cycle. So I'm going to show you a picture that I've got here. The migraine timing cycle. This is from Hargraves. And it starts down there 1, the trigeminal activation. Let's imagine this headache starts at 8 o'clock Monday morning. So 8 o'clock in the morning, trigeminal activation occurs, and the patient starts getting headache. Trigeminal nerve goes to the face, supplies the sensation to the eyes, face, and all that kind of thing. All right, stage 1. Stage 2 is the release of these neurochemicals, neurokinin, substance P, and CGRP. And that occurs about 20 to 40 minutes between stage 1 and stage 2. And then by stage 3, these chemicals cause in about 2 hours after stage 1. So the headache started at 8. We're at 10 o'clock in the morning with 3 of meningeal dilatation. The arteries dilate. And then stage 4 occurs at 3 to 4 hours. Again, this story I'm telling you, at about 11 to 12 o'clock. The thalamus is inflamed, and then you get central pain transmission. And that's where the headache's really the worst, because the thalamus is your pain center. So migraine turns on your pain center, and that's what causes headache to be so bad. That's why migraine is disabling. Most people who have migraine have to go to bed and lie down. They can't be up. Okay, so you got those features of medication overuse headache that goes along with this migraine timing cycle. Now, it's stage 2 where the neurochemicals are released that causes the headache, vasodilatation, inflammation of the thalamus. Now, remember, a single episode of migraine can last 4 to 72 hours. So that's like 3 days, 72 hours. Thus, a migraine can last up to 3 days, and patients tell me their migraines lasted a month or a week or 5 days. Well, that's really not a single episode of migraine. That's likely migraine that's been transformed into chronic migraine, and it comes from overtreating. So what's going on here? It's from the metabolic features of the brain related to the release of these inflammatory vasodilating chemicals that cause neurokinin A and CGRP. They've actually stuck a needle in the jugular vein and sampled neurochemicals during a migraine that they produce in the labs. They give somebody a migraine, like give them nitroglycerin, they get a headache, and they get a migraine, they get a headache. And all these neurochemicals in the jugular vein that's going from the brain down this way into the body, all those neurochemicals increase. And so we know that these are the features of migraine. All right, so that's the purpose. That's the whole thing about triptan drugs that came out in 1990. There's 7 drugs. Those drugs block the release of these neurochemicals. So if you take a drug at stage 1 when trigeminal activation is going on at 8 o'clock in the story I was telling you, and you take it early on, then stage 2, 3, and 4 don't occur. And I've spent my life talking to patients to try to get them to treat early. So watchword with migraine always is using triptans is to treat early. But the problem with triptans are they're contraindicated in patients who have hypertension, angina, who've had a stroke, have coronary artery disease, and there are renal arterial problems. The reason is you can't take triptans from some patients. And the other thing is only 70-80% of patients will respond to a triptan for treatment. But the ones that do, if they treat early, they can be headache-free in 2 hours. And currently in American medicine, there's no drug works better than that. But if you treat late, they don't work as well. So now, if the patient's had a 3-day migraine and they keep taking their caffeine or Tylenol, even an opioid narcotics during that period of time, what happens then is, for some reason, don't really understand these, the brain comes sensitized to these drugs. A repeat doses causes neuroinflammatory chemicals to keep coming out, and it keeps the headache going on. So overtreatment causes the brain to cause these neurochemicals to come, and the headache just keeps going on. I once saw a migraine patient who's about 65 years ago, and she'd been overtreated with Advil since her mother told her when she was a child it's okay to take 4 to 10 Advil every day. And she had a headache every day until I saw her from a child to age 65, and I just took her off Advil and she got a lot better. I saw another guy, just to make an example of this little clinical story. This guy was 60 years old. He'd been taking 10 Excedrin migraines, each of which has 65 milligrams of caffeine in it, a day since he was a child to treat his headache. He was having headaches all the time. He had migraine. So both these patients improved by detoxing off the medications that they've been taking. And these are kind of benign stories of simple over-the-counter drugs, Advil and caffeine, mixed in with many patients that all headache doctors have seen who've been taking hydrocodone or tramadol or barbiturate drugs. Now, I always tell my patients that the worst drug for treatment of migraine, the ones that causes medication overuse headache more than any, are barbiturate drugs like Fiorinol. Marilyn Monroe overdosed on a barbiturate drug, a sleeping pill. It was a terrible tragedy. Just kept overdosing, was sleepy, and it killed her. Barbiturate drugs used to be used as sleeping pills, and nobody uses them anymore because you can't dialyze them out. So you can put the patient in the renal dialysis thing where they take your blood and they remove chemicals. You can't do that with barbiturate drugs because they last so long. You have to put patients in the ICU, intubate them, and keep them there a week or something before they wake up. So these drugs stay in the body a long time. They don't dialyze out. And it seems like a lot of doctors have been educated at some point during their time where I practice in Dallas, Texas, that these drugs, the barbiturate drugs, are helpful for treating headache. And these are, God bless them, really doctors that don't know a lot about headache. They don't practice neurology or do headache, and they'll give these drugs out to patients. But the truth of the matter is, barbiturate drugs have been banned in every country in the world except Canada, the United States, and we can't get them banned in the United States because the drug makers market our politicians. Politicians blow off doctors, and so we can't get rid of the drugs. And the sad kind of a statement you'll hear at headache meetings, I've heard before at headache meetings in America, is that barbiturate drugs are the only reason you go from Mexico to the United States to purchase a drug, because you can buy hydrocodone in Mexico without a prescription, but you can't buy Fioral. All right, what are the drugs that usually cause medication overuse headache? They can be caffeine, such as Excedrin, BC powder, and Vanquish. Pseudoephedrine, that's the decongestant. It's the over-the-counter sinus medicine, which is found with Tylenol Sinus or Tylenol D, Advil Sinus, or Allegra D. So Allegra D has Allegra, which is an antihistamine, works on the immune response for allergy. The D part is a decongestant. And remember that there is no sinus headache. That's another whole story. And Sudafed drugs are used in the drug world and changed into methamphetamine, which causes a horrible addiction problem and deaths. All right, there are ergotamine drugs that are used for treatment. There's a Cafergot, Ergomar, and Migraine. I told you originally these are not used that often anymore. Triptans, such as Imitrex, Maxalt, Zomig, Axert, Frova, Relpex, or Merge. Aspirin can give you a headache if you take too much. NSAIDs, that's a medical term which means non-steroidal anti-inflammatory drugs such as Motrin, which is ibuprofen, and Advil, naproxen, which is Anaprox, Aleve, Loxicam, and Tylenol is added to that group. And of course narcotics like Vicodin, hydrocodone, Narco, Tramadol, Demerol, Nucynta, OxyContin, Tylenol with codeine. And then drugs with barbiturates such as Fiorinol, Fioricet, Frenulin, and Eschec, or generic butalbital. Now I'm not going to get into this in great detail today, but the treatment of medication overuse headache is educating the patient what they're doing and trying to get them off the drugs. And it's easier to do for triptans, ergotamine, over-the-counter drugs, NSAIDs, caffeine, than for opioid narcotics or barbiturate drugs. Although I'll hear many patients say to me, they'll say, "Oh, doctor, you mean I gotta get off my caffeine?" And I said, "Yes, I'd like you to get off your caffeine." And they'll get off all the other stuff they're taking, which are opioid narcotics, and it's so hard to get off caffeine because the caffeine is also addictive. In America, we just want to take a pill for treatment and make whatever suffering you have go away. But it won't happen with patients who have a migraine and then develop medication overuse headache. Now, I've got other articles written along this range, and the same thing. If you go to Dr. Migraine on the internet, I have articles on, expand this medication overuse headache problem. Do NSAIDs cause medication overuse headache? Well, yes. Caffeine and migraine, because so many people take caffeine, get headache from it. Medication overuse headache can be confused with cluster headache, which is really a different headache type, is worse. Caffeine discontinuation improves migraine headache symptoms. I wrote an article called Caffeine is a Drug. The American Psychiatry Association says it's an addictive drug at a level of 240 milligrams a day. And then I have an article on medication overuse headache, in which has the best treatment ideas on treatment there. I also have a podcast on medication overuse headache on iTunes, and this I'm making as a YouTube video. So, God bless all you people with migraine. Please don't overtreat. Hope you do well. Thank you very much. I'll see you again on another talk. Bye-bye.